Hello, everyone, and thank you all for joining us during the Lytham Partners Winter 2021 Investor Conference. My name is Adam Lowensteiner, Vice President of Lytham Partners. During this fireside chat, we welcome Reliq Health Technologies, ticker symbol of RHT, that is Robert Harry Thomas on the Toronto Venture Exchange, and RQHTF, that is Robert Quebec Harry Thomas Frank in the US, and its CEO, Lisa Crossley. Before we begin, for those not familiar, Lytham Partners is one of the country's leading investor relations firms. With more than 2 decades of corporate access experience, we have built one of the industry's most diverse and effective platforms for connecting small cap companies with high quality and focused institutional investors while creating a framework of best practices in all aspects of investor relations. Today's fireside chat is hopefully yet another example where we can bring value to multiple constituents. We will dive into questions in a moment, but for one final item, I want to remind everybody that Reliq Health Technologies is available for one-on-one meetings later this week. If you have not already signed up, please send me an email at lowensteiner@lythampartners.com or visit www.lythampartners.com/virtual and click the one-on-one meeting request button. With that said, let's begin. So let's start, Lisa, with you providing a brief overview on the company and your background.
Sure. So we're a health technology company. Reliq is primarily focused on the US market because the US is the largest single payer in healthcare and the largest healthcare market in the world. We are based in Canada, but we have offices in Texas and Florida. And we're focused on providing virtual care solutions to the $100 billion chronic disease management marketplace in the US. And my background, this is the fourth company that I've run as CEO, the first that's publicly traded. I've been at Reliq for almost 6 years now. And we spent the first few years really building out the platform, but we're now at a point where we've gained significant customer traction. And this is a point for us that's really an inflection point where we're looking at very rapid growth for the foreseeable future from here.
So 2021 really flew by. It was an interesting year. We had the release of the vaccine for COVID. What are some of the key accomplishments Reliq achieved this year and that you're proud of and would like to share with investors?
Yeah, I mean, there have been quite a few. This has been a really good year for us. The first 6 months were a little bit slow thanks to the pandemic, but once the vaccine started rolling out in the US, we really saw growth start to pick up really towards the end of June of 2021. Since then, we've grown significantly. We've signed dozens of new contracts with new clients. We've kind of graduated to more large-scale clients. We did hit a revenue run rate. We did about 1.6 million in revenue last quarter ending September 30th. And we expect to hit a revenue run rate by the end of this quarter, so end of December of 2 million per month. So we're definitely on track to achieve all of the goals we set out for ourselves at the beginning of this year. And certainly getting through the pandemic was difficult for most health technology companies, but I think we're really seeing that rebound and the demand for proactive preventative solutions for the chronic disease patient population. And I think we've done a very good job of establishing ourselves as the standard of care in that space. So we are growing very much exponentially.
So improving human health care is at the forefront right now, maybe even more so due to COVID. I mean, COVID has definitely turned the healthcare system on its head. What are you now seeing in the healthcare system? How does Reliq remedy some of the pressures on the healthcare system?
Yeah, I mean, as you know, the sort of peak of the pandemic was a difficult time for companies like us that are focused on proactive preventative care, because really all of our clients had to focus on the urgent needs of COVID patients. But since the vaccine rollout, and so really for the last half of this year, we're seeing a lot more clinicians who are saying, I kind of had to put my chronic disease patients on the back burner during the pandemic at its peak, but now I really urgently need to get back to doing something that's going to improve health outcomes for that patient population. And I think the one benefit of the pandemic is that it did get a lot of clinicians who weren't initially comfortable with the concept of virtual care or remote care for patients. It got them a lot more comfortable with that idea. And in addition, Medicare and Medicaid did significantly increase the reimbursement levels over the last year and a half, 2 years for the services that we offer or enable through our platform. So, the pandemic had some challenges for all of us, but I think it really did kind of accelerate adoption of virtual care technologies, probably by, at least a decade, and relative to where we were pre-pandemic. And we're definitely hearing from our healthcare customers that, because of things like the Delta and Omicron variants, hospitals are really very concerned about keeping their intensive care units from getting overwhelmed with COVID patients again in yet another wave. And that's created a lot of market pull for our platform, because really what we do at our core is we keep these chronic disease patients healthy and at home, and we keep them out of the hospital. So these are the patients who typically account for 80% of all healthcare spending, and it's because they're so frequently hospitalized. And now that we're all kind of living with COVID indefinitely, and hospitals are communicating to physicians in the community, you have to keep your chronic disease patients out of the hospital. We're completely overwhelmed with COVID patients, so we cannot afford to have people coming in with preventable complications. And that's where we come in. We really help keep those patients more stable, and we identify any early warning signs so that their clinicians can intervene while the patient is still at home, instead of having to wait until they show up in the emergency room and are looking at an intensive care unit stay.
Maybe you could walk through us, what's the opportunity here for Reliq? What's the addressable market? And then, are you the only player in the marketplace, and how do you differentiate yourself?
Mm-hmm. I mean, it's a massive market. There are at least 37 million Medicare and Medicaid patients who have 2 or more chronic conditions like congestive heart failure, diabetes, high blood pressure, kidney disease, asthma. So, that's an enormous market for us. That's over $100 billion right there. And the interesting thing is that Medicare and Medicaid have started expanding billing codes so that it no longer is required that a patient who would be on our platform have 2 chronic diseases. They might have just one. It might be asthma or a musculoskeletal issues. That's a new billing code that's being introduced for next year, where we'll be able to provide remote care for people with things like arthritis that maybe we weren't able to before. So I think that the total addressable market is massive, but it's also really rapidly growing. We have a population that's aging as well as growing. And as that population ages, you're going to see more and more patients who do have chronic diseases. And we are very good as a healthcare system at keeping people alive for an extra decade or 2 versus where we were, even 30 years ago. And where we haven't been very successful to date is in giving those patients good quality of life in that last decade or 2. And that really comes down to managing these chronic diseases better in the home so that patients can continue to live independently and stay out of the hospital, to avoid that sort of typical cycle with chronic disease patients where they're, start at a certain level of health, it declines to the point where they have to be hospitalized. The hospital gets them back up to a certain new normal, which is not as high a level of health as it was before they were admitted. And you have that kind of gradual decline over time. And we're really able to kind of interrupt that process and keep patients much healthier for much longer, which gives not only them a better quality of life, but also really impacts on their families positively.
And just how did you differentiate yourself? Are you the only player?
Right.
Maybe.
Yes. So the way that we differentiate ourselves, for one thing, we have a first market advantage. We were really the first company to get out there and work across multiple states in that Medicare and Medicaid funded virtual care space. And we're really the only company that has a completely comprehensive, holistic platform that will address not just cardiac diseases or respiratory diseases or diabetes, but does everything. We plug and play with 97% of all devices that are out there, including kidney dialysis machines, CPAP machines for patients who have sleep apnea. And I think one of the key differentiators for us is the patient experience. Generally, if you Google remote patient monitoring, you'll see a bunch of company websites come up and they all show, fancy apps on tablets. But really, with this patient population, they're on average 75 years old. They have multiple chronic diseases. They're taking dozens of medication. They're not very tech savvy and they're not interested in becoming tech savvy. So we give them very simple devices that they're already used to: a glucose meter, blood pressure cuff, a scale, and a spirometer that you blow into. And those devices will actually provide audible reminders every day to collect their vital signs. But for the patient, it's basically a very low-tech experience. They don't have to remember where they put their tablet or what their login info is, or to charge their tablet. There's no tablet involved unless they specifically wanted one. And we deploy in a fully multilingual platform. So we have quite a few Russian patients. We have a lot of Spanish-speaking patients, and we have some Cantonese and Mandarin-speaking patients. The unique thing for us on the patient side is that we meet patients where they are. So if you're living in a community where there's no internet access, or you don't have internet in your home, we can collect data from the devices over the cellular network. We can provide the reminders to you and any phone calls that we might make in the language of your choice. So for the patient, it's a very accessible patient experience, and where you would typically see with a remote patient monitoring company, that they might get 20% adherence with patients. We get over 99% because we have really focused on that patient experience. And the benefit for us, the sort of sustainable competitive advantage is, in order to break into this market, you really do need a couple of years of solid clinical data, as well as reimbursement data that proves that clinicians who use your platform do get paid by Medicare and Medicaid. And we have 3 years of that data now. So, we're able to conclusively show that clinical metrics like hemoglobin A1C for diabetics or blood pressure for hypertensive patients come down significantly when patients are on our platform. We also know that we reduce hospitalizations by over 90%, which is really the metric that physicians are either penalized or rewarded based on. And we've got 3 years of data showing that our clinicians do get reimbursement and that they do very well financially by implementing the program. So, we've got some very compelling technology, a great user experience, great workflows to support clinicians, and we've got the data to back that up.
Can you share how you're selling the iUGO platform? And how long is the sales cycle? How quickly can you get practices up onto the platform?
Yeah, so initially we started out selling primarily to individual physician practices and home health agencies. We kind of started off as a company in Texas because the area that we focused on, the Rio Grande Valley, has the highest rate of chronic disease of anywhere in the United States. So there was a definite need there. And they have a lot of patients who are living in remote and rural communities, lower income communities, and so sort of a population that had been traditionally ignored by a lot of other healthcare companies. And we've expanded significantly, since then. But we were able to sell initially through some sales reps that we had in the Texas area. At this point, we get a lot of our sales to the individual practices from inbound calls. So, one physician in a community will start using our platform. After 2 months of them getting paid by Medicare and Medicaid, we'll get a call from 6 of their colleagues saying, my friend, Dr. So-and-so, is making all this money and his patients are staying at the hospital. And when can you get me onboarded? And with those smaller individual practices, usually we'll sign a contract and, the next month we'll onboard all of their patients. The pace of onboarding is really dictated by our clients. So whatever they're comfortable with, that's what we do. We can onboard an almost unlimited number of patients in any given month. So there's no kind of constraints on our side, but in healthcare, it is very typical that enterprise-wide deployments of software can be staged. They'll typically be phased, with a few facilities at a time and then move to another geography. So with the individual practices, everybody gets up and running all at once. Now that we're working with a lot of the larger networks, so we have a business development team in the States that's essentially former C-suite level executives from long-term care facility networks, from surgical supply companies, and other healthcare technology companies. So they're very established in the space. They have fantastic connections and networks. And when we go to the larger networks, so say a network of home health agencies or skilled nursing facilities, or a managed care organization, it's our business development team that gets us in there and gets us in front of their C-suite so that they can make a decision quickly. We can, with those large clients, again, if they want to put on 100,000 patients next month, that's not a problem for us. And typically they will stage the rollout. So we might do, 1 or 2 of their facilities the first month, then 6 facilities the next month, and, gradually over a year, or if they're very large, over 2 years, and deploy throughout their entire patient population. But that's really dictated by the client. We're able to kind of respond to any pace that they would like to set.
Can you share with us how many patients are onboarded as of this conversation?
May not know right to the minute, but we're over 35,000 at this point. We expect to hit 40,000 by the end of December, and we certainly will. And I think we're looking at a pretty significant rate of growth. That not only are we kind of keeping pace with a significant rate of growth now, but we're very much prepared for that rate of growth to accelerate significantly in 2022. And I think we're very well positioned as a company to support that kind of growth.
Can you share with us any initial feedback, that customers or patients have been, on the iUGO platform for a few months already?
Yeah, I mean, we've had some patients, a small number, but who've been on for quite a long time. But any patient that we've put on the platform, we get very positive feedback. I think what the patient population really likes is, A, it's flexible, it can speak to them in their language, and B, it's not complicated, it's very, very simple for them. But I think they like that, it's not a camera, so it's not something that they feel is invading their privacy, but it really gives them back some independence. So, instead of worrying all the time if you're aging in place that you're going to need to move to a long-term care facility soon, this provides that safety net. We give you the reminders so you don't forget your medication. We help you manage your chronic disease. But if something goes wrong, your primary care physician will be notified immediately. And they can, for example, if you're a chronic obstructive pulmonary disease patient and the readings on your lung function have been declining for a few days, your doctor will give you a call. They'll be automatically notified by our system that there's an issue. They can give you a call and they can change your steroid inhaler, or they can add an oral steroid, they can prescribe an antibiotic. But all of those things will work together to improve your breathing, to keep you from being hospitalized for pneumonia, which is the typical path for those patients if they're kind of left to their own devices. And so patients love it because it keeps them out of hospital. They also love that it doesn't feel intrusive. So it's something that's there to support them, but it respects them as a person. It's not treating them like an infant. It's really recognizing that these are, grown adults who deserve to be respected and just might need a little bit more support to take proper care of themselves, given that they're managing very complex clinical conditions on their own in the home. And it provides a safety net, which, both patients and families really, really like, because it means that, they're not required as the patient to be the primary clinical manager. They don't have to remember, well, a 2-pound weight gain, I'm supposed to call the doctor, or, if my blood glucose has been going up for 4 days, I'm supposed to call the doctor. They don't have to remember to write down all of the vital signs they capture every day. That's all taken care of them, for them. So they know that if there's an issue, they're going to get a call and someone's going to step in and help. And I think they really like that, sort of at arm's length, non-intrusive approach to really supporting aging in place, which is what most of these patients want to do.
Can you discuss some of the data or the type of data that is gathered from patients that are on the iUGO platform, and how valuable is that data, or how valuable can that data be for the company in the coming years?
Yeah, so we collect all different kinds of vital signs data. So we can do lung function, which you measure with the spirometer. It's called forced exhalation volume. And we can track your ECGs, so your electrocardiograms. So we can look at heart rhythms and electrical activity in the heart. We can look at pulse oxygenation. And so that's very timely with COVID. And we can look at your weight, your blood glucose, and you look at your blood pressure. There's a host of other variables we can measure, but basically what those data points are doing, in the short term is providing clinicians with information that allows them to triage patients and decide, who needs attention when. But long-term, that data, it's a really unique data set. Historically, any data that was collected in the home was patient self-reported. So they might have their own glucometer and every day they're writing down their results. And we know, anyone who's run a clinical trial, as I did at the beginning of my career, knows that patients are not terribly reliable self-reporters. So they often will forget to collect the data, and before they go into their family doctor's office, they'll kind of write out a bunch of results based on the one result they did remember to collect. Or if there's a high blood sugar or blood pressure reading and they feel embarrassed, don't want to share that with their doctor, they'll kind of fudge it a little bit lower. So historically, data that was collected in the home didn't have a lot of value because it wasn't objective, it was very subjective. In our case, we're collecting this data directly from reliable FDA-approved health monitoring devices. So it's objective data. And we're collecting a lot of data on different conditions. So typically in a clinical trial, you'll have a patient who's got one disease, for example, and they're taking usually one or two medications. In this case, we're looking at very complex patients who may be taking dozens of medications a day. They may have 8 different chronic diseases and cancer or multiple sclerosis or gout. So it's a really rich data set that has never existed, that rich objective data set before. And so that will be extremely valuable to the company. We keep a copy of all the data we collect, we anonymize and de-identify it. And in 2023, at which point we will have quite a large patient population on the platform, and we will have been following some of these patients for several years, that data set becomes incredibly valuable. And we can license that data to research institutions, pharmaceutical companies, they're the primary purchasers, and governments. I mean, there's really a broad range of clients who would want access to that data. So I think, really from 2023 on, that's going to be one of the company's greatest assets is that data.
So you recently announced a new application for the iUGO platform, Hospice. How does that work? What's the opportunity there? Aren't there going to be a lot of short-term patients on the platform? I mean, how large is the hospice market for Reliq?
So the hospice market is currently valued at about $30 billion annually. It's growing pretty significantly. And where you're really seeing growth in the hospice space is in hospice at home. And that's primarily what we target. We certainly have products that will work in a hospice facility, but a lot of what we're doing in hospice is aimed at patients who are receiving palliative care at home. So these are patients who are end of life. And we know that at the end of their life, 50% of all Medicare patients are going to receive hospice care. So there's quite a large demand for hospice care, millions of patients a year. And it's true that an individual patient will probably only be on the iUGO platform for hospice care for, say, 6 months. And however, from our perspective, it's not really who the individual patients are. And we're dealing with the healthcare organization, so typically the hospice care agency. And when an individual patient passes away, they are replaced with another client of that agency. So, we're not going to see kind of a lot of volatility in the number of patients that we have with a given client. And it almost doesn't matter for us who that patient is. So if patient A dies and patient B comes onto the platform, there's not a lot that we have to do. We do the electronic pre-authorizations, but those are automated. Most of our onboarding process is fully automated. So it's not a lot of work for us to change over with those patients. And we keep, at least that number of patients. A lot of these agencies are growing, so we'll typically see an increase in the number of our hospice patients over time with each individual client. And what we do for hospice patients, it's again, largely based on their particular circumstances, but they can use our pendant or watch so we can track them for things like falls. And so that, since they are in the home, if there's a need for intervention by someone will be notified. But we also do things like tracking pulse oxygenation, which we can do through the watch or other pulse ox devices. So that's important when you have a patient who's on opioid pain medication. So end of life for a lot of cancer patients involves significant quantities of opioids. And if you can sort of titrate them so that you're hitting that sweet spot where you've got maximum pain relief, but minimum respiratory depression, because drugs like morphine can make you stop breathing. And so that's, something you really have to watch for in this patient population, that you're not overdosing them on drugs. But patients who are receiving hospice care in the home tend to have less effective pain management because their clinicians have to worry about that, fine line between respiratory depression and pain relief. If you can monitor them regularly and have alerts set up, and even maybe alert the family members so that they can intervene, then there's a lot more leeway to provide really effective pain management, which is really important for the quality of life at the end of life, that you're as comfortable as possible. And of course, the system can alert clinicians if patient has an acute crisis or is, really at that very end of life. And that allows, clinicians to communicate with family members. Now's the time people need to, go be with their loved one. So I think there's a lot of different things that we can do. It's kind of a marriage of our IUGO Home and IUGO Care platforms. So it's monitoring of vital signs, but it's also monitoring other things like movement, sleep, pulse oxygenation is a pretty important one, and fall detection. It's quite a comprehensive product. And I think it's going to see a lot of traction in the hospice at home space.
I know this is a little bit out there, but can the IUGO technology platform be used with veterinarians and monitor pets? I guess what I'm going at is there are other ways for Reliq to leverage the IUGO platform, maybe internationally or to other industry applications, similar to what you just described about with hospice.
Yeah, definitely. I mean, there's applications in veterinary medicine, and I'm a big fan or proponent of good veterinary medicine. I have 3 dogs, and one of them, they're all only 2 years old, but the Newfoundland, who's 150 pounds, just had both of her rear knees operated on. She tore her cruciate ligaments in both of them, which is not uncommon in that breed. But, we took her quite far away from home to have the repair done, about an 8-hour drive. And so, in working with the surgeon, we're doing everything remotely. We've been lucky she hasn't had any complications, but I think our system would work really well if you're accessing specialized veterinary care and then you're going home, which is also something that, humans do. They seek out the best surgeon and then they go home. It can keep you connected to that surgeon. It can help you track the medication for your pet and make sure that you're administering it properly. You have, through our platform, you can upload photos. So if you have a pet who's had surgery and you're concerned that the wound's not healing well, you can take a picture of that and send it to the vet, and the vet can say, yeah, that's a problem, either bring them in or I'm going to add an antibiotic or a steroid. And so I think there's absolutely potential for this to be used in the veterinary space. I mean, obviously in the human health space right now, we're looking at primarily clients who this service is paid for by Medicare or Medicaid. It's not the same in veterinary medicine. There's no sort of government sponsored insurance, but I think there's applications for our platform in the consumer space, both on the veterinary side, but also, if you think of when my grandmother was aging in place. So in Canada, we don't have billing codes for any of this, but she was 95, living on her own in a condo in Ottawa, and taking a lot of different medications for a lot of different conditions. And our family is full of doctors, my mom, my aunt, so, 2 of my grandmother's daughters. And we really wanted to be able to monitor her and to track not just things like medication compliance and her blood pressure, but also, is she opening the fridge? Is she getting out of bed? And those are things that using IUGO Home with certain sensors, that we can provide that are very inexpensive, you'd be able to track all of that. So down the road, I think we will have a consumer-facing product that will sell, where there'll be kind of a suite of hardware that would plug and play with the system. You're paying as a family, let's say $40 a month, something like that, and for access to the cloud, but you're able to get a lot of insight into that relative who lives, maybe on Park Avenue in a condo in New York City while you're living in California. You're going to know if you called her and she sounded sick, but she said she was fine, but then she doesn't get out of bed for 24 hours. And you'll get a lot of information out of that platform. So I think there are definitely consumer-facing products that we will launch, probably towards the end of next year. And that may be in the veterinary space, it may be in the consumer human space, it may be in both. But I think there's a lot of kind of adjacent markets that we can pursue for our technology in addition to our core business.
So circling back a little bit on a earlier question, what, if any, levers did you pull in 2021 that as a result you have some sort of that will have some sort of impact into 2022 and beyond, and that investors should be aware of?
Yeah, I mean, I think, when we started out, even at the beginning of this year, we were mostly focused on remote patient monitoring. But as there's been significant uptake for some of the new billing codes like behavioral health integration or transitional care management, principal care management, we've really expanded the platform to support those. We've expanded to new disease states like HIV, as well as expanding into hospice care. I think one of the biggest levers is that we have kind of graduated to being able to attract the attention of larger scale networks instead of just individual practices and home health agencies. So, that really allows you to grow significantly, kind of a logarithmic jump in terms of the number of patients you have access to, and therefore, over time, the valuation of the company, the revenues that you'll generate. I think we did use the time period of the pandemic to, really flesh out our platform and make sure that it's very scalable, to develop a lot of automated processes around onboarding, which in 2022, you'll see translate to, much more rapid onboarding of patients. I think the fact that we've diversified geographically pretty significantly. We were sort of very focused in Texas at the beginning of the year, and now we're in Puerto Rico and Florida and Kentucky and California and the US Virgin Islands. There's a lot of room to grow in all of those areas. California is the most populous state. Puerto Rico has 2 million patients who have chronic diseases, and there's a real unmet need there. And so I think we kind of pulled a lot of levers in this year that will really translate into significant value for shareholders next year.
So anything else that you want to focus in on before we conclude?
No, I think this is a period of rapid growth for Reliq. I think we're definitely at an inflection point. We'll be cash flow positive in the new year. And we had a positive adjusted EBITDA that really just backed out the non-cash expense of share-based payments last quarter. And share-based payments will go way down going forward. That was something we used to kind of bridge the gap when we were growing. We incented a lot of our sales and business development people with options instead of having to pay salaries. But we're now at a point where we're paying salaries and commissions because the revenues are coming in and we're doing well. So, I think the company's poised for pretty significant growth going forward. And we're looking at some big value creating milestones coming up, like, a NASDAQ uplisting next year. I think it definitely makes sense for the company, given that our market is primarily in the United States. And we're a tech stock and we're rapidly growing. When we get to the right stage of our evolution, we would definitely be looking to uplist to the NASDAQ. And based on the contracts we have right now, I think that'll happen later next year. So I think it's a good time to get involved with the company, whether you want to invest right now or just start following this story. I think you're going to see a lot of tangible milestones achieved over the next 6 to 12 months. And I think there's going to be very rapid growth in the space, but certainly for Reliq specifically.
Great. Lisa, thank you very much for this summary and for your participation today. We greatly appreciate it.
Thank you for having me.
Sure, our pleasure. To anyone else out there who hasn't signed up for a one-on-one, again, feel free to send me an email, Lowensteiner@lythampartners.com, or again at www.lythampartners.com/virtual, and then click on the one-on-one meeting request button. With that said, thank you very much, and we hope everyone enjoy the rest of the conference.
Bye, everyone.